Welcome, my name is Peter Strong and I provide online Skype counseling therapy for anxiety and depression and for work with addictions and many other common forms of psychological suffering that are due to habitual reactive thinking. So the primary way that we go about changing anxiety and depression is by looking for these underlying patterns of habitual reactive thinking. Thinking does not cause anxiety or depression, but when thoughts become reactive, they tend to feed the anxiety and depression, very much in the same way that fuel feeds a fire. The fire needs that fuel in order to stay alive, and it's the same for anxiety and depression and most other forms of emotional suffering. They require fuel to keep going, and that fuel is provided in the form of habitual reactive thoughts. The issue that most people have is that they're not aware of these thoughts. They're not aware of them in the sense that they have a conscious, objective relationship to these reactive thoughts. The most typical situation is that the reactive thoughts become habitual. They operate subconsciously out of awareness. So we may be aware of the suffering and we may be aware of the triggers that led to that suffering, but we're not really fully consciously aware of the reactive thoughts that are generated and that feed the underlying anxiety or depression. So the chief object in mindfulness therapy, which is what I specialize in, is developing a fully conscious relationship with your reactive thoughts so that you can see them very clearly. The more that you can develop an objective awareness of your thoughts, the less power they will have to create the underlying anxiety or depression. So basically this is equivalent to seeing how a fire is being fed by fuel and then taking away that fuel source, which you can do when you become conscious of that fuel source. You can then bring in the element of choice, of inner wisdom, to decide whether to continue feeding the fire or not. And it's the same with reactive thoughts. The more conscious you become of them, the less power they have over you. So how do we go about changing our relationship to our habitual reactive thoughts? Well, the primary method that we use in mindfulness therapy is to develop skills in mindfulness meditation. Now, mindfulness meditation, as I teach it, means meditation on the mind. It means seeing these unseen habitual reactions that determine our emotional well-being and also affect our perception and our decision-making and our behaviors. So we deliberately meditate on our emotions. If you're suffering from anxiety, then you will meditate on your anxiety to look for these habitual reactive thoughts. When you see those habitual reactive thoughts, you then stay conscious. You train in staying conscious as an observer and not becoming identified with those reactive thoughts. This problem of reactive identification is really the main issue. It's more important than the thoughts themselves. thoughts are just thoughts at the end of the day. They have no power. But when you identify with them, when you believe them and take them to be true, then they gain power and they create emotional suffering. So we're training to look at those thoughts and not identify with them, and not believe them, not disbelieve them either. It's not necessary to analyze the thoughts. It's not necessary to try and convince yourself that the thoughts are irrational. You're not trying to really get rid of the thoughts. All you're trying to do is cultivate that all-important conscious awareness. When you can see the thoughts, then you have choice. And so through meditation, you can begin to break the habit of reactive thinking, worrying, rumination, and so on. That is the real fuel source for the underlying anxiety or depression. When you cut off the fuel source, then you create the right inner environment in which those forms of emotional suffering can heal. Anxiety and depression will heal the moment you stop feeding them with reactive thinking. You can also increase the rate of healing by developing not only a conscious relationship, a mindful relationship with those thoughts and emotions, but also developing a relationship based on friendliness and compassion. So you learn to develop a friendly relationship with your anxiety or depression. You develop a friendly relationship with the thoughts that feed that anxiety or depression. To be friendly means that you are free. That is one of the characteristics of the free mind, the mind that is not identified. It is free, and in that freedom it can develop those qualities of friendliness and compassion. These are two essential aspects of mindfulness. Mindfulness is the development of direct conscious awareness, characterized by friendliness and compassion. So when you bring that quality of mind to your anxiety or depression, that will greatly accelerate the rate of healing. So if you don't feed the fire of anxiety and depression, those emotions will heal by themselves eventually. But if you add in the ingredients of friendliness and compassion, then you accelerate that rate of healing considerably. So this is a brief overview of mindfulness therapy. There's a lot more to learn, and I will teach you all about how to apply mindfulness to overcome anxiety and depression during these online Skype therapy sessions. So if you would like to schedule some online counseling therapy sessions with me, then please go to my website, send me a request through my contact page, tell me what times work for you, tell me more about your particular situation, and we can schedule some sessions, and you can see for yourself just how effective both online therapy is, and also how effective mindfulness therapy can be for healing emotional suffering. So please contact me and let's get started. Thank you.